Hey everybody, it's Dr. Roach. We're here today talking about finger thoracostomy, and we wanted to go through the indications and actually the steps through the procedure itself. So what are the indications? Truth is, you already know all the indications because you know the indications for needle decompression. So finger thoracostomy is the same indications. It's just that we think the finger thoracostomy is not only a safer but more effective way to eliminate the tension pneumothorax. All right, so specifically, let's just talk about some of the indications. 1, tension pneumothorax, and 2, cardiac arrest. So you find a patient that's had penetrating or blunt trauma and is in cardiac arrest. This is a life-saving measure, but it is a sort of a last-ditch effort to save a patient's life. And you're gonna open up both cavities of the chest wall and eliminate the tension pneumothorax. So that is really the last and final step before we terminate a resuscitation for traumatic arrest. All right, everybody, so we're going to go through the process and procedure for doing finger thoracostomy. So the first step in the process, you want to get the patient's hand back behind the head if possible. That would be the best position. The mannequin doesn't do that. So let's start talking about the anatomic position. This is the clavicle, this is the mid-clavicular line, okay? This is the axilla, this is the mid-axillary line. So you're going to count down to the ribs, and the ideal place is either that we put in the protocol the third mid-axillary intercostal space. So that would be just above the fourth rib, because the intercostal spaces are named by the superior rib. So in that case, it's either the fourth or the fifth. The point of this is that I want you to be higher, not lower. You're not going to cause damage when you're in this between the third to fifth intercostal space is a safe place to be. Any of those places are okay. What we're saying is, if I have my perfect choice, above the fourth rib would be a really good place to go. Now, a general landmark is the nipple. So just lateral to the nipple, that's where you're going to find the third, fourth, and fifth intercostal space, right around that area. So, but be careful with the nipple location, because obviously some nipples are lower than others in this situation. So I would suggest counting out the ribs and making sure that you're higher, not lower. Again, lower, you could potentially get into the abdomen, where on the left side there's the spleen, and you could go right at the spleen. So we want to avoid that and go up towards that third or fourth intercostal space. Okay, currently we don't have one package, so I want to show you. These are the things. So you'll get a hyphen chest seal, and you'll get your H&H Crite kit. That has all the equipment that you're going to need to do the finger thoracostomy. Obviously, I have my hands, I would be glove, and I would have my PPE on that's appropriate for this scene and all of that. So that's assuming that that's the case. But this is a video, so we're going through this. Now, first I have my hyphen chest seal that I'll have out and ready to go. That's going to be here. Okay, and then I'm going to take out the contents, ripping this contents open and removing all the equipment from the H&H kit. Okay. Now the main thing from the H&H kit that I want to find is this piece here, which has my 10 blade. Okay, the 10 blade is the most important piece. The second most important piece is this here. This is a needle driver. Okay, the needle driver and the 10 blade. Okay, so what am I going to do? If you have the opportunity to clean the space, great. Again, this is an emergency situation. You may not have that opportunity, which is fine. You're going to take your blade, you have your space, find just above the rib. You're going to make an incision, and this is not meant to be microsurgery here. Okay, this is a procedure that's very, very critical. You're going to make a nice size incision. This is not the time, again, to be, too precise. You're going to make a nice incision here. Now, to get this done easily, you will find the rib and cut just above the intercostal space. So you make an incision through that fascia there, which can be difficult. If you have strong fingers, you could potentially put your finger right through that area. But again, not everybody has that. I actually could put my finger through both of this now. I don't even need the needle driver. But let's say you're small, fingers aren't strong enough to do that. You can guide this in with your finger right over the needle driver and find that space. Once you find that space, you can open up with the needle driver, and if it is a tension pneumothorax, it's like a balloon bursting. So you'll hear a gush of air. So that's that. Now I have my finger, I feel the gush of air. I can actually feel the lung with my finger. I know that I've accomplished my task. I've potentially relieved the pneumothorax. So that's the key there. Once that's done, in the hospital, we would put a chest tube through that hole. We don't want to do that. We just want to seal this, because if you don't seal this now, this becomes a sucking chest wound. We want to avoid that. So we're going to take off our hyphen chest seal, and we're going to apply this hyphen chest seal right over this area. Okay, we're going to make a nice seal, and this hyphen chest seal sticks really nice. So now that area is sealed, and then you want to mark this, BSO, this, if you have something to mark with, that we place this ostomy here into the chest. And that really concludes the procedure.